One of the most common questions I get on a regular basis is, what is the role of the disc and the joint when it comes to back pain? And I was teaching a nurse practitioner the other day, and I pointed out 3 key structures that you want to think about when it comes to pretty much all back pain. Those 3 structures are the disc, the facet joint behind it, and something called the foramen, where the nerve comes out. And what normally happens in the spine, and this happens to everybody, is that the disc is the first structure usually to start to get affected. And what happens is it starts to lose water content. And once you lose water content, that disc starts to become stiff and starts losing some of its pliability. As time goes on, there's a chance that disc now can start to settle and bulge out. As it settles, it causes the joint on the back to start to ride on one another, and that sets up early changes that are arthritis of the spine, essentially. And then the nerve, as it's exiting, is going out a hole called the foramen, and there's an area where that nerve can get pinched. So when you're thinking about back pain, think about this trifecta of disc, joint, and foramen, and how those components interact to cause back pain. I'm going to show you a little diagram here of those structures, but hopefully that improves your understanding of how back pain originates and how it progresses. So here's a close-up of those 3 structures that we were talking about. These are the discs in between your spine bones. Here are the joints on the back. These are called facet joints, and there's a capsule around each one of these. And this is the nerve coming out. This hole right here is called the foramen. So just imagine that as these discs start to harden and settle, it causes these joints now to ride on top of one another. So you can see, if you lose that spacer, how this is now going to grind on top, and that's going to start causing these joints to be affected. And that's called spondylosis or facet degeneration, essentially arthritis of the spine. And then as this thing narrows, that can actually start pinching the nerve as it's coming out. So some people can lose this disc completely and not pinch on that nerve, and others just get a small amount of settling and they start pinching on that. But when it comes to back pain, think about that trifecta. It's the disc that then sets off the facet grinding on one another, and ultimately the disc and the facet and this hole can start to impinge on this nerve. And that's where surgical intervention needs to be discussed. Prior to that end stage, all these changes can be dealt with non-surgically.